Okay, guys, are you ready? Now, let's talk about today about toxins in the body when it comes to plastics and such, pesticides and these things. But I want to talk about xenoestrogens, these fake estrogens that get into the body. And I know cancer patients in particular, they give you estrogen blockers. And so we're going to discuss that primarily today. And I want to focus on the women today. We'll get to the men on the next video. But I want to show you, first of all, when people ask me the question, what are these xenoestrogens? And I'm going to share a screen with you here and show you what I look at every day. So let's make sure you guys can see this really big and blown up here. There we go. So xenoestrogens, what are they? They're synthetic industrial chemicals. You look at solvents, lubricants, byproducts, plastics and such, flame retardants, pesticides, DDT, pharmaceutical agents. There's a lot of things that are xenoestrogens, and they're basically estrogens. Now, what does the medical world normally do? They give you tamoxifen, right? And so if you're a cancer patient and they said you need to get these estrogen blockers, and they say you need to stay on this for a year or 2 years. Well, one thing they don't always tell you is what is the side effects here? And I want to go over for breast cancer patients in particular, what are the side effects, right? Well, hot flashes to be one, mood swings, fatigue, nausea, vomiting, weight gain, vaginal discharge or dryness, irregular menstrual periods, increased blood flow, increased risk of uterine cancer and cataracts. I don't know about you, but those are things I probably would not want to do to my body. Now, they call them AIs, aromatase inhibitors, and tamoxifen is in that list. So they also can give you what? Decreased bone mineral density, osteoporosis, musculoskeletal disorders, diarrhea, decreased libido, and just a numerous amount of things, the side effects that you don't always know as the patient, right? So what do women normally do? They normally decide to it's safer to detox their chemicals from the body instead of taking the risk of the side effects of the drug, right? A lot of information below. There was a Hubbard method years ago for getting toxins out, but I want to go down a little further and talk about a few other things. Um, Look at PCBs belong to the broad family of man-made organic chemicals known as chlorinated hydrocarbons, all right? Carbon, hydrogen, chlorine atoms. And then they have other treatments of these xenoestrogens, foreign estrogens, if you will. EDTA chelation was one years ago. Did you see me highlighted right here? Okay, now they have EDTA in a form with microsomal global healing that we use, and you don't have to inject the needle in your arm anymore. You actually can take it by mouth, right? So the need for it, breast women were compared to women from other women with breast diseases, and they had 50 to 60-fold higher levels of organochlorine compounds, including pesticides, PCBs, in their breast tissue than others without. So, not to spend a long time to let you know that it's really dangerous to use chemical estrogen blockers, guys. There are plenty of natural estrogen blockers that do things a little differently. And if you look here, there's a list of things I have for you, from the cruciferous vegetables to flax seeds to the green tea, redesorol and turmeric, a lot of things, right? Look at DIM, didolamethane. It's been around for a while. You'll see this product a lot in maca, like how we use it. And then you'll see maca itself is used as one, right? Plenty of others that you see here on my list. Calcium D glucarate, we're going to talk about that more in just a moment, but I just want you to take a look at this list as I go through it of what these blockers are. Okay, here's the list again. Right. Now, lifestyle tips are also important to know. Maintaining your healthy body fat. Excessive body fat tissue can raise estrogen levels. Exercise, limiting alcohol, avoiding these plastics, which can be very difficult today to avoid all these plastics in your environment. But I want to go down a little further. Okay, bear with me, guys. Now, let's talk about calcium D glucarate. It works to lower estrogen. So it supports the liver detox. And this is a matter of not you doing the olive oil and these things. It's just taking a pill. Very simple to do this. It helps break down the estrogens in the liver and remove them a little more simply than they would by themselves. So a simple process is the trash unpacker, as they call it. Your gut bacteria normally produce the enzyme, right, which can unpack the trash. But this the calcium D-glucarate can suppress the enzyme so the trash stays bagged, meaning it's easier for it to be removed out of the liver, right? So going down to keep this really simple, here's what I want to mainly talk to you about today. So if you decide to go the natural route, and get away from these chemical ones with all the side effects. Here's just a recommended stack that we normally do in our office. So ladies who like to go the natural route with other colon cleansing and liver detoxing, we recommend that they take the DIM. And the DIM comes in a nice maca formula that we have. Maca is also on that list of helping with the excess estrogen, and that also helps to balance hormones in general. This is the dosages, and this helps shift estrogen into a weaker, safer metabolite. So it basically breaks it down. The calcium D-glucarate, you see we have similar dosages, but no, normally when I'm looking at the dosages, I'm using the kinesiology guys to muscle test what your body says it really needs. So this helps to remove estrogen and prevents its reabsorption. And then you'll see zinc involved in this. So other things you'll see along the way, but these we found quite successful. Ladies are very comfortable in taking this, and it works, guys. Now, what I want to discuss with you is to be involved in this is don't depend on just these things to remove the estrogen or keep it broken down simply in the body. Be more active in your health, be more proactive. Like I said, the colon cleansing, the colonics, the liver and gallbladder flushes that we recommend. When you do these, guys, have no fear about these excess estrogens in your body because you're always going to be getting the plastics. All the food today is wrapped in plastic. Look at the store, the chicken, the meats, the vegetables. Everything is in plastics and styrofoam. So it's really hard to avoid these things, but really being proactive and get involved in removing these, have no fear that your body's gonna be just fine. Just keep your tubes and keep your liver from being clogged up, and your body will detox these things just fine. So there you go, guys. Natural estrogen blockers today. I'm Dr. Price. You guys have a great day.